If the whole point of bisphosphonates is to strengthen your bones, why do they put you at risk for osteonecrosis of the jaw? Why do they? It's a mystery. Actually, it's not a mystery, but I kind of treated it like it was until I looked it up. Let's start analogizing so that we can get a handle on this whole bisphosphonate thing. Remember back to undergraduate work, however long ago that might have been. Even back in the early 90s, we knew that osteoblasts were bone-building cells, osteoclasts are bone-breaking down cells, and osteocytes are cells in the living bone matrix. I know that's counterintuitive. It feels like osteoblasts should blast apart bone tissue, but that's not how it works, no. So if you think about osteoblasts and osteoclasts as masons, no, not the conspiracy theory kind, like bricklayers, stonemasons, bone masons, we can kind of get a picture of what's going on here. The osteoblasts lay the bricks down, building up the walls that make up your bones. Osteoclasts come through and they scrape off the extra mortar and they find the broken bricks and break them down so that the osteoblasts can fit things in more tightly and more neatly so that everything is working well, right? So there's a substance in the bones that helps keep the osteoclasts under control. Because let's face it, it's a lot easier to break things down than it is to build things up, right? Pyrophosphate is in the bones to help slow down the osteoclast, breaking it down. We can think of it as sort of the mortar in between the bricks, even though that's not quite a perfect analogy. So basically, in order to keep things in balance and to tip things a little bit more into the osteoblast's favor, we have some pyrophosphate in the bone to help slow down the osteoclasts and help things keep balanced, as it were. However, if you have osteoporosis or Paget's disease or metastatic cancer affecting your bones, then you can imagine that makes it a lot easier for those osteoclasts to pick apart that bone. Everything gets sped up, and the osteoblasts are working as hard as they can. They just can't keep up. So here, enter bisphosphonates. A bisphosphonate will get into your bone tissue in the place of the pyrophosphate. They look enough alike that nobody notices that they slipped in there. But they do behave a little differently, and that's in two separate ways. So the first way is that it's just harder to break down than the pyrophosphate. It holds things together better than the pyrophosphate. So that slows your osteoclasts down a little bit. Think of it as being like a harder mortar holding the bricks together. So the osteoclasts have to chip away at it a little bit harder to be able to make any progress. But that's only a very small part of what's working there. The real slowdown is that the way the osteoclasts pull the mortar out and pull the bricks apart is that they ingest them. And bisphosphonate is kind of like putting a bunch of Quaaludes into your mortar.
Really slows things down.
So on a good day, the osteoclast might take a little nap after ingesting it. On a bad day, could end up paralyzed, overdosing, a lot of not good things. So in short, we have industrious bricklayers, a distractible cleanup crew, and drug-laced mortar. So slowing down the osteoclasts give the osteoblasts a chance to catch up. This doesn't help a whole lot with bones that are already broken, but if there is damage to the bone and it's not broken yet, it can really shore things up to make it harder for that bone to break. In my head, I picture the osteoblasts reaching around the drooling, drugged-up osteoclast and slapping a few bricks in a damaged section to help bolster it up before they've had a chance to pull it down. And as a bonus, your patient's calcium level will drop. So that's why a couple of them are indicated for hypercalcemia of malignancy. So stronger bones, good. Osteonecrosis, bad. What makes the jaw so susceptible in this situation? There are a combination of factors. Factor number one, you got teeth. Teeth are embedded in the jaw. Teeth do not have skin on them. No matter what you feel like might be on there on that hungover morning, teeth don't have skin on them. And as we know, skin is the #1 infection preventer that your body has. Keep the germs out, you're in good shape. I don't mean to creep you out, but bacteria can crawl all the way down your teeth, especially if they're not in good shape or your gums are not in good shape, and work their way down into your jawbone. Next, when a dentist works on your teeth, even though they're being super careful, there's a lot of sharp, pointy instruments. And even though they're sterile when they put them into your mouth, once they're in your mouth, they're not sterile anymore. Also, jaws are susceptible to trauma. See the scar right here? A scar right there? That's where I landed when I fell up the stairs at work. That was the last time I've been to the emergency room at work. Hopefully, it will be the last time I've been to the emergency room at work. And finally, jaw bones, your mandible and your maxilla are under a heck of a lot of stress. We don't think about how much stress that we create inside our mouths. And I'm not just talking about me gritting my teeth when I'm trying to get that IV while that patient's kicking me. There are up to 55 pounds of pressure between your incisors when you take a bite of the apple. And when you're chewing up the apple, there can be up to 200 pounds of pressure on your molars. That's a lot of pressure. And if you don't believe me, think about the last time you bit your tongue. That's a lot of pressure. All those factors keep the damage coming. And your jaw bones, your mandible, and your maxilla are constantly at work, keeping all that damage cleaned up. Here's where the osteonecrosis comes in. If we artificially slow down that cleanup that the osteoclasts are doing, that can open up a whole world of hurt. If you think about it, it's kind of like our bricklayers are working in a black mold infested basement in an earthquake zone, and we just put the cleanup crew on downers. So here's where we're going to take the analogy a little bit too far. So if you think about it, our blood supply is kind of like plumbing embedded in those brick walls. So as long as the plumbing is good and we're able to get the white blood cells and things to those inner bricks, I know we're taking it way too far, then things are good. Your bricklayer, the osteoblast, is chugging along like normal. Osteoclast is not cleaning up after it. There's a lot of damage. The osteoblast keeps cramming things into little nooks and crannies, trying to bolster things up. But if there's not enough room for that plumbing to go through there, i.e. your blood vessels, then all those poor osteocytes that are trapped back there are gonna die, just like in the cast of Amontillado. So that's kind of where our analogy breaks down completely, because we're not building a brick wall, Edgar Allan Poe notwithstanding. We're building living tissue, and it needs circulation. So the plumbing, our blood supply, is damaged. There's no way for our white blood cells to get in there and fight off infections. There are infections going on because we got punched in the jaw, and then the dentist nicked us while he was cleaning our teeth, and we had bad teeth anyway. And there's no way for those blood vessels to take away the waste products. So basically, it's a bunch of crap wrapped up in there, and before you know it, it's necrotic. That's osteonecrosis of the jaw, in a very large, over thought out nutshell of an analogy. Here's a true story. My wife's grandfather built a house for his family and decided that it would be a good idea to embed the plumbing in the basement. That house is no longer livable. What he needed was some osteoclasts to clean up all that concrete after that first pipe busted. So what does this mean to you, dear nursing audience? So before you hook up that reclast or shoot them with that Prolia, ask them about their teeth. And if they haven't seen the dentist in a while, or they have any issues ongoing, don't stick them yet. Call their doctor. Call their nurse practitioner. Figure out if it really is a good idea for them to go ahead and get this drug today. I've had providers thank me for being vigilant about this. These drugs work wonders for a lot of people, but there is a rare but very real chance for some lasting damage if we give it outside of recommendations.